Daile, thank you for having us today.
No problem.
Very much appreciated. Your institution, Children by Choice, is one of the family service centres that are directly affected by the law passed and the way the laws are implemented.
Mm-hmm.
How do you evaluate the current laws of the state of Queensland regarding abortion and people's access to the abortion services?
So we actually published a research paper last year on the post-decriminalisation of abortion in Queensland and what were the barriers that still existed for people to access abortion. So in 2018, obviously the laws were changed, and we are a service that offers counselling, information and referral to people who do need to access an abortion. And so we have data and information on how those people are able to access and what are the barriers that people face in Queensland. So what we found from that research was that people in Queensland are still finding it difficult to access abortion, even though it has been made legal. Because we are such a large state, a lot of people have to travel quite significant distances to access an abortion. It's not offered in every hospital service across the state. And we also don't have a lot of GPs who are offering primary health care for early medical abortion. We found that cost was actually one of the biggest prohibitors for people to access the pregnancy outcome that they wanted. And certainly the stigma that comes along with abortion really had a huge impact for people, even being able to get the right information on where to or how to access an abortion. And one of the biggest significant factors that we found in our client group was people experiencing domestic or family violence and actually having being in controlling relationships where they couldn't access the medical care, the finances, or travel, or be able to make their own decision about their pregnancy outcome. So we found in our data, 43% of our clients actually mentioned intimate partner violence as a huge barrier to accessing abortion.
That's staggering. Mm-hmm. That's staggering.
Yeah, so there's definitely systemic issues that still need to be fixed in Queensland, but then there are also, I guess, societal issues and stigma and reproductive coercion and violence that we need to consider when people are trying to access healthcare.
And 2018, and these figures absolutely, 2023 we are now. So we're on the 5th anniversary of the acceptance of abortion in Queensland. So have the government activities implemented abortion laws, has that been satisfactory? So
2018, it was December, so we're kind of just on the 4th anniversary. We're sort of getting to the 5th one at the end of this year. And after they changed the legislation, they certainly did have a really clear directive to hospitals across Queensland that people that are marginalised or vulnerable should be able to access abortion, and that should be publicly available to them. So what happened there was each area made the decision themselves as to how they were going to implement that change in the legislation, and some of them implemented abortion and termination of pregnancy care within their own hospital systems, and some of them partnered with private providers so that people could access an abortion through a private provider. What that's found 4 years from now is that we've actually got a concentration of abortion deserts where some people can access abortion based on their postcode fairly easily and quickly, and other people have a real issue because they might have to travel hundreds of kilometres, or it might be really unclear actually where they have to go and how to access the care that they need. So while I think that the government, when they changed the legislation, did have the idea that this should actually increase people's ability to access abortion, what we're finding for nearly 5 years on is that that's not the case for everybody. And so there is still more work that needs to be done. And I do feel that there is a commitment from the government that now that they have legislated it, there needs to be access across Queensland.
How did you find access ways to abortion facilities that the government provided in Queensland? And this figure is, we're talking between 10,000 and 14,000 annually abortions in Queensland.
Yep. Yeah, and that figure is fairly, standard in terms of our population. So we know that 1 in 4 people of reproductive age or that can reproduce will have an abortion in their lifetime.
1 in 4.
1 in 4. So abortions are actually not that uncommon. And we also know that 1 in 4 of those people that access an abortion identifies as being Catholic. So it's not a religious thing. People from all different walks of life will need to access an abortion at some point. We know that the World Health Organization says that if every person used contraception perfectly every time they had sex, we'd still have 6 million unintended pregnancies per year. So we will never get rid of abortion.
No.
Contraception is not 100% effective. So the fact that we need abortion is not a bad thing. It's actually just a part of healthcare. It's a part of what a pregnancy outcome might need to be. So in terms of with Queensland, what we expect to see after decriminalisation is actually a reduction in the number of abortions that occur. That's the international research that's out there. What we found in Queensland is that we don't actually collect data. So that's why we've got a data set that's between 10,000 and 14,000. That's a pretty big data set to sort of go an approximation of. And the reason for that is because abortions happen in so many different settings and there's no collection of information. So you might have someone that goes to their GP to have an early medical abortion under 9 weeks. You might have someone that can access an abortion within their public hospital system. And then you've got a lot of people who go to private day clinics or obstetrics and gynecology services to access a surgical termination through there. So we don't actually collect all of that information. So it's really difficult for us to actually figure out how many abortions are occurring.
Really?
And then to figure out whether we're doing really good primary prevention for contraception, for sex and healthy relationships education, and for even pregnancy outcomes education, so that we can actually see whether any of the health measures that we're doing are having an impact and any of the legislative measures that it put in place is actually having an impact on the amount of abortions per year. So it's a really tricky one to actually comment on.
So why is there no data? How can we cannot make people say you have to collect data?
That's something we've been talking to federal and state governments with because it's across Australia. We do have a few states, WA and South Australia, who do collect their data. And so we're trying to think about, how we can harmonise what the states and territories do across Australia so we can actually get better data to inform practice, to inform healthcare, to inform resourcing, to inform workforce development so that we can actually best help people access the healthcare that they need.
In your opinion, to what degree of important is family health is abortion? Is it a medical necessity?
Absolutely. As I said earlier, there will never not be a world we won't need abortion. It is sometimes the best and only pregnancy outcome that somebody can access, whether that be because of their own health, the health of the fetus, or just because of, psychosocial circumstances. We know that we speak to about between 15 to 20% of people who access an abortion in Queensland every year in our service. And we know that there are often complex circumstances that have led somebody to make a decision, and there are often very not complex circumstances that have led somebody to make that decision. There's a great study out of the US called the Turnaway Study, and it tracked 1,000 people over a 10-year period, and it tracked people who were given the abortion that they wanted and people who were denied the abortion that they wanted, and what the outcomes were for them. And what they basically found was that the outcomes for people that were denied an abortion, a wanted abortion, were lower socioeconomic achievements, increased exposure to domestic and family violence. There were significant impacts on the person who birthed as well as the child or existing children. Generally what happened with the people who were given the abortion that they wanted is they went on to have healthier, happier, more sustainable lives. They went on to have children when they wanted to have children. And even the maternal mortality rate was higher in the people that were forced to have to continue pregnancies they didn't want. Suicidality rates were higher, mental health rate, so we know that there's actually, some research and evidence that says, one, there's always going to need to be abortions in the world, and that two, denying people abortions has significant health impacts on everyone involved.
And everyone around them too.
Absolutely.
How are the government facilities for abortion covering Aboriginal and Torres Strait Islanders, refugees, asylum seekers, and the homeless people? Have children by choice specific programs for them?
We don't have specific programs for different cohorts. We do try and look at our resources and the way that we communicate and present our information so that it is really accessible to people. So we've done a bit of co-design work with women with intellectual disabilities, people from multicultural communities, to make sure that we're actually producing easy, understandable resources on abortion and contraception and reproductive coercion for those communities. what we find is that there are some areas of Queensland that have really great Aboriginal controlled services, or really great sort of community-based services that understand the needs of their communities. And sometimes we try and work closely with those communities because they already know their communities and their needs.
Yes.
And if they need our support through pregnancy outcomes or post-abortion, then we can offer that. What we find is that the cohort of people that are most vulnerable and disadvantaged and kind of left out are people who don't have access to Medicare. So visa holders, temporary visa holders, etc., students, international students, they basically don't have access to any of the publicly funded available services. And the services that they do have access to will cost them double the amount that, if I were to walk in, something might cost me $800, it would cost them double that. And so then it becomes additionally inaccessible because of the financial impact. And so not only having the barriers of where to, how to access this information in an easy to understand way, having a supportive health professional to help you through, but also then finding out that actually it's going to cost, X amount of dollars. And so it can be a really distressing time for people with any additional vulnerabilities or barriers to accessing healthcare as it is.
As an accredited institution, have you been consulted to update the current rules? Are you involved with that?
Yeah, so we were consulted well before the legislation changed. Children by Choice has been around for 50 years now.
Congratulations.
Yeah, so we were originally founded in 1972, and the reason was to reform abortion law in Queensland. So it took us 40 years to get there, over 40 years, but we got there. So we have worked quite closely with Queensland Health and the Queensland Government on the legislative reform, but also how that's then implemented within Queensland Health, within our primary health networks. And we're still working with them. And, I think it's a really important part of their consultation and collaboration of making sure that they do, now that they've legislated something, that they do treat it as healthcare, as they said, and make sure that it is accessible, especially to the most vulnerable and disadvantaged
people. Does your counselling include the advice to keep the child and continue pregnancy? And if yes, under what conditions?
Yeah, so we offer a all options pregnancy decision making counselling service. And so basically for anybody that is decision making about their pregnancy, we work on a person-centred approach, non-judgmental, non-directive, and we sort of work with the person through, do they have any ambivalence? Do they have any, external or internal issues that we need to explore to help them with their decision making? But essentially, we're not directive, and we have helped many people to, decide to continue a pregnancy. We also discuss adoption, kinship care arrangement and alternative care arrangements as well. Adoption is not very common in Queensland, but there are kinship and alternative care arrangements. And so while if people do choose that an abortion is the best option for them, because there's no other service that actually helps support them through the process of accessing that, we do continue to help a person if abortion is their option. If something like they choose pregnancy, they want to continue their pregnancy, and we've closed our counselling session because they've made their decision, we support them to access a service that will help them with their antenatal care, their maternity care, and any parenting needs that they might have, because there are lots of organisations that have those services out there. So we're really good at linking into appropriate services that people might not know exist, that based on the conversations our counselling team have with them, that we can sort of help link them up so that, they can be supported in their decision making. Yeah.
So it's all the linking, isn't it?
Absolutely.
And what are the biggest barriers to your institution's activities?
The biggest barriers, I guess, is definitely the stigma. Stigma is a big barrier because the stigma that's perpetuated around abortion doesn't treat it as healthcare as it should be treated. And so that means that we can have some of our clients, they can go to 6 different GPs and be told different information before they find their way to us, and then we can actually help them through. A lot of it is misinformation, but some of it is people within systems creating unnecessary barriers because of their own moral views. And so we believe that we really need to destigmatise abortion now that we've decriminalised it and treat it as a form of healthcare. You know, one of many pregnancy outcomes that need to be treated as healthcare in our public health systems, funded effectively, and we need to be more transparent about how to access things. So certainly resourcing is a big thing for our organisation. We're only a small organisation, but we do a lot of work across Queensland. We're the only type of organisation of our kind in Australia. So quite often we're really stretched to do a lot of our educational counselling work, and we do everything that we can to try and work on, you know, advancing reproductive autonomy for people, and also helping professionals that work with people who might become pregnant to actually know what their obligations are, what the legislation is, and how best to support somebody in a non-judgmental and destigmatised way.
The only one in Australia is in Queensland.
Yes, in the unique work that we do. There are some other telephone counselling services or telephone information services that are focused on pregnancy options or abortion, but we do our counselling, our education work and advocacy. So we do sort of a few different things and we sit outside of Queensland Health. So we're not funded by Queensland Health to do our work, which means that we can be really independent in the way that we operate, and we kind of operate almost like as a consumer advisory group. Yeah.
So who funds you?
We are funded by the Queensland Department of Justice and Attorney General. So they fund a lot of services to do women's health and wellbeing counselling. So that's and education. And so a lot of DV services are funded in a similar way to have some of that women's health and wellbeing funding. So that's the funding that we're under. We also do some fee-for-service work and fundraising and get grants to do different activities. So
very good. What are the items your clients are most in need of? What's their requests?
It's mostly information. There is just so much misinformation out there, and there's not a lot of transparent information about how people can access. And I guess, you know, if you think about it, there are people with levels of privilege that can easily find information or pay, you know, to go to a private clinic quite easily. But as soon as, you know, pregnancy is not something, unless you are planning for it, that you really expect. And so it's an unexpected thing. It's an unexpected expense. It is quite costly. We know the cost of living for people is huge. And for a lot of people, if they all of a sudden had to find, you know, $80 to go to the GP, a couple of $100 for an ultrasound, possibly a blood test, another GP appointment, then maybe, you know, $800 to $1,000 for an abortion itself, people wouldn't be able to come up with that money very quickly. And so we're finding that, you know, cost is a huge barrier. People want to know about the cost. They want to know about where they can access, and they want to know whether they can access any care in their local communities. And unfortunately, in some local communities you can, but in a lot you can't. So for some people, even just having to travel makes a huge difference. So a lot of it is people just wanting information from us. As I said, we do offer counselling. So we do have, you know, we do have a demand for our counselling service, decision-making counselling, but also post-abortion counselling. But certainly a lot of it is information and just support, someone to, you know, to listen to them and to help them through these confusing systems.
I'm glad you mentioned some figures, because it's staggering when you add it up how much it costs.
Yes.
So how do you plan to celebrate the success of your project, of this project?
Yeah, well, we celebrated our 50th year last year. We had a few activities. We did a gala dinner at Parliament House with the Attorney General as our host, and a few people over the years who have contributed to our organisation. I think as an organisation that has such a rich history, where there were some points in our history where, you know, the Joe Bjelke-Petersen days where the Green Slopes clinics were raided, and our organisation actually shredded all of our client information because we were worried about people who accessed our service actually being criminalised, or doctors being criminalised for helping, you know, women and pregnant people to access abortion. So celebrating that, you know, we have actually got law reform, but that there's still some work to do, and that at the moment we are, you know, really trying to work closely on behalf of our clients to actually make things better for them. I think for our counselling team, it's really good for them to see that the advocacy work that we do, that all of the work that you know, we do as an organisation actually has an impact in their clients' lives. But they also see the really tough times, and they are the ones that also have to pick up some of the pieces from the barriers that are unnecessarily created to access. But we do try and make sure that we celebrate the wins, and the fact that our organisation has, you know, celebrated 50 years is a real win for us.
Fantastic. Congratulations.
Thank you.
And finally, is there anything you would like to mention in this interview that I have not covered in my questions?
I don't think so. I mean, I think a lot of people, Queensland's such a big state, and some of the focus is always on regional Queensland, that, you know, access to any healthcare in regional Queensland is really challenging. We've seen out of Gladstone at the moment that their maternity unit has, you know, been completely disintegrated, and they've got to get all of these new obstetricians and gynecologists. You know, we'd really like to see that any sort of, you know, forms of healthcare that are, like all hospitals that do any sort of maternity care should be doing termination of pregnancy care. And they do in some circumstances, but not others. So we'd really like to see, like, how does that destigmatisation of this as healthcare, how do we support the workforce to actually have some planning to make sure that we've got people within across Queensland. Conscientious objection is a big thing in Queensland. It's part of our legislation, and it means that any doctor can object to providing an abortion. And unfortunately, we've got a lot of people who are kind of using that to stop any care happening within entire systems, entire hospitals. So we'd really like to see that, you know, while we want to balance the rights of a person to conscientiously object to providing abortion, we also want to balance the rights of the person who needs to access this healthcare in a timely manner. So I think there's still some work to be done on how we balance both people's rights, recognising that a doctor probably, you know, has a little bit more power in this situation than the pregnant person who's needing an abortion. So we're doing a bit of work on how we actually are a bit more patient and client-centred, and how we make sure that timely access to care is not impeded. And we're really hopeful, I think, that we've got the Queensland and federal government committed to change, but we'd just like to see what that looks like and how they're going to resource it effectively.
Fantastic. Thank you very much for today. Very much appreciated.
Yeah, no problem at all. Thank you.